Dr. Kevin Sack, I'm a brain and spine surgeon now based in Kuala Lumpur. I've previously trained and worked in the UK and now I've returned back here. Brain tumor is basically an abnormal growth in the brain. It can be made up of different kind of cells depending on the origin. And based on that, we decide whether it's benign or malignant and what the treatment will be then. I think the most common type of brain tumors are going to be those that have actually metastasized from elsewhere, meaning it is spread from a primary cancer. It can be most commonly from lung cancer, breast cancer, it can be from colorectal cancer. So it has spread to the brain, and when it spread to the brain, we consider those metastatic tumors. If you talk about primary brain tumors, means the origin is from brain tissue itself, then the most common tumor is going to be a glioblastoma, short form of GBM. If we talk about benign tumors, the most common form that we see is a meningioma. Traditionally, brain tumors are treated with surgery. It could be via open surgery, or now what we can do is also endoscopic surgery. But probably the best treatment would depend on what kind of tumor it is, whether it's going to be benign or malignant. Typically, malignant tumors are going to be treated with surgery followed by chemoradiotherapy, whereas with benign tumors, if you are satisfied that you have achieved a gross total resection, meaning everything has been taken out, then only surveillance is required. Now, there are limitations to this. The limitations are basically where the position of the tumor is, its accessibility, and its relation to eloquent structures, meaning parts of the brain that control important functions such as speech and motor function. Now, where those are concerned, there are ways to operate while keeping the patient safe, and this is by doing awake surgeries where the patient is actually awake while you're taking out the brain tumor. So basically, after a consultation and we decided that probably Gamma knife is the best course of action, the patient will be admitted, and then we take them down to the Gamma knife suite and a frame is applied. This is a stereotactic frame. Stereotactic frame basically will allow us to localize the tumor with XYZ coordinates in space. Okay. After the frame is applied, and this is done under local anesthetic, the patient will have very slight discomfort from the injection of local anesthetic, but there shouldn't be much pain, and once it's applied, they're usually quite comfortable with it. And patient subsequently goes for MRI, and the MRI is then loaded up onto the gamma plan, and then we start by delineating the tumor, meaning we will draw out the tumor, which we see on the scan, and subsequently deliver the correct dose to that tumor. Once the plan is ready, the patient gets put in the Gamma knife and treatment starts. Now, the treatment can range anywhere from 20 minutes for a simple lesion to maybe an hour or two for more complex multiple lesions. Once that is done and the treatment is completed, the patient's frame is taken out, and usually they go home on the same day. They can either go home the same day, or if they live far away, they go home the next day. There is actually no discomfort involved when the treatment is ongoing, and the patients can actually pause the treatment at any point of time. They want to go to the toilet, they can go to the toilet, or if they feel a bit claustrophobic or they want to move around a little bit, we can pause the treatment and then continue on after that. Not all patients are going to be suitable for Gamma knife radiosurgery, so it would depend on the kind of tumor that it is, whether it's going to be benign or malignant, and also the subtype. Mainly, the main factor is going to be the size of the tumor. Above a certain volume, I personally wouldn't Gamma knife the patient because it causes a lot of toxicity to normal brain tissue. The indications for gamma knife radiosurgery are basically for various types of tumors. It can be malignant or benign, but most commonly we use it for meningiomas, metastatic tumors, acoustic neuromas, some recurrent pituitary tumors, and vascular lesions like arteriovenous malformations or cavernomas, and also functional issues such as trigeminal neuralgia, which is actually a facial pain syndrome caused by vascular compression of the fifth nerve. Now, all those things are perfectly amenable to gamma knife radiosurgery. If you do have a brain tumor, make sure the person that you're seeing you're comfortable with, and they understand, the doctor understands what your concerns are and what your requirements are. And it's always helpful to have more than one opinion.